Hello everyone, I'm Louis Bernetti and I'm back again with another education video for our stroke education series. And today we're going to be discussing vision following a stroke and the different types of visual challenges that might be experienced following a stroke. So I'm going to go ahead and share my screen with you guys and get started for today. So with vision following a stroke, there are multiple different ways that vision can look after a stroke, depending on where the stroke occurred and the impact. So we're going to be kind of discussing those in a bit greater detail following here shortly. So first, I want to start with what we call neglect. And so in differentiating what neglect is and having a better understanding of what it is. So again, we can better set ourselves with goals and treatment plans in the future if we have more of an understanding of what it actually is. So when we have neglect after a stroke, that is typically often on the left side, and it's where people don't recognize things on their left side. And so maybe they're eating their food and they eat everything on the right side of their plate, but nothing on the left side. And you're like, hey, you still have some food left on your plate. And they're like, no, I don't. And you turn the plate and then it comes into their field of view on the right side. They go, oh, here it is. Or they may not even notice somebody on the left side of them the whole time. And you have to like tap their shoulder, or you kind of come around, or you have them turn, they come see you, and then they see you. Well, this is called neglect. And it's not actually a visual loss, but it's more of a loss of attention and orientation. And so neglect is not classified as a visual loss because actually there's no damage to our ocular fibers. However, it is more so of a disorder of attention because of the lesion and damage that results in a lack of response to stimuli in one half of the visual field. So it's just impacting the area that gives attention. So it's our visual impact, the visual fields, the visual fibers, those are all well intact. It's the brain providing attention to that area and why it's not being attended to and why it's being neglected. That's what the kind of the phrase of why it's being called neglect as opposed to a visual loss. It's really just not even noticing it. You're kind of just neglecting it all on its own. And that's why a lot of the people they don't recognize it because it's not a problem because they're not even paying attention to it. And so it's important to know why that is. So you're not expecting somebody to just, oh, they just can't see it. No, it's because they're just not even attending to it. So kind of making people aware and working on orientation and attention with somebody with neglect is important. So having them work on, look to their left and, practicing on, really trying to focus on their left side. So what can you do to kind of help somebody who has neglect? Well, place some important or desired items on the affected or neglected side. So when I say this, I only mean like place more luxury items on the left side. Not all luxury items, but just some. But keep important items for health and safety on the right side or whatever side is strong for them so that they can access them and see them. But keeping like a phone or a remote or cards or whatever it be, a drink, anything that is like kind of interest or desire on the left side or the affected side so that they have to attend to it. And it might take practice and it might take you cueing them, but having something that they have to kind of always be looking that left side to grab or get is a good way to kind of try to rework and remember to attend to that left side. Involve the neglected side and hand in activities. So when you're doing stuff, try to always involve it, try to make sure when they're eating, that they're still using that neglected side. So if, let's say their left side again, make sure that they're using their left hand when eating, either it's them holding down the plate, if it's them, helping rotate the plate so they can see their food. Involve that side as many times as you can throughout the day. And then lastly, promote awareness of the affected side with tactile or verbal cues. So what that means is, if you've noticed that they're having a hard time attending to that side, maybe verbally tell them, hey, you should look to your left. Look to your left or look over here, or touch them on that side. And they say, hey, I'm coming up, I'm gonna touch you. Look over here. And you tap their shoulder, they can look that way. Just kind of provide them cues to look that way. Next up is visual field cuts. And so this contains two parts. It contains our peripheral and our central vision. And so each eye has its actually own specific field of vision. Our left eye has its own field of vision, and our right eye have its own field of vision. So the right eye and the left eye are obviously going to have some overlapping visual areas in the middle because they both can kind of come in this way. However, far to the left, only the left visual field can get it because that's the peripheral vision. And only far to the right is that in the right eye's field of vision. So this visual field loss is a loss in an area of vision in your visual field. So whether that be on the far left, on the far right, which would be peripheral vision loss, or it could be more central and could be more impacted in the middle where they kind of overlap. And this can be impacted based on where the stroke occurs, where it impacts the ocular fibers. And so that can kind of differentiate between. And so that is where the difference between neglect and vision loss would be. So if you had a, let's say, peripheral vision loss here, now that is a loss of vision and not attention because there's damage to the ocular fibers that help you see that side. So your left side of there is impacted, but it's not because you're not paying attention to it, right? It's because it's truly gone. So with visual field cuts continued, typically the visual loss is the same side as the weakness. So for example, if we have a left hemisphere stroke, as we know, that's going to result in right-sided weakness. Then typically visual loss is going to be on the same side. So it's going to be more of a right visual field loss because almost everything that happens on one side of the hemisphere of the brain impacts the opposite side of our body, including our vision. So the most common type of visual field loss is something called homonymous hemiopsia. Homonymous hemiopsia. I am maybe pronouncing that incorrectly, but basically what it is that it's a loss of half of your vision. So either the right or the left field of vision is missing from each eye. So you're missing about half of your vision. And this is again what actual visual half of your visual field loss would look like as opposed to what neglect is, where it's lack of attention and orientation. This again is actual loss of that visual field. And then other types of visual field losses include quadritanopia, which is loss of a quarter field of your vision, central vision, which just means low vision. So you're just kind of getting lower vision as a result in kind of affecting your overall vision. And then scotomas, which are random areas of visual loss. So just kind of in your visual field, just random spots are not accessible for you. And so the best way to access these and work with these is you can work with an occupational therapist or a low vision therapist for strategies to navigate your daily life with these. And also go see an ophthalmologist, see a neuro-ophthalmologist specifically who specializes in working with stroke survivors and how to kind of navigate these environments. So those are good ways to there's ways that you can help with things called prism glasses, which are types of eyewear that help you access more of your environment through the lenses. And those have been shown to be beneficial ways for some individuals to, navigate these visual field changes. And just kind of going more in depth, as I kind of touched on a few of these, some treatment. Visual field recovery can occur, but it typically takes about 3 to 6 months post-stroke. And recovery, again, depends on the damage and the area of the brain affected. And then the following treatments that I'm discussing here and kind of discussed earlier, again, they're not going to cure any type of visual field loss, but they're more so there to help with adjusting and adapting. That includes visual search strategies. That'll be discussed with, an occupational therapist or a low vision therapist on strategies that you could use to make sure you're scanning your whole visual field that's accessible to you to make sure you're moving through an environment safely. Reading, using line guides, maybe colored markers or magnifiers, any kind of adaptive utensil or tool or equipment that could help access reading, maybe bigger font, maybe instead of, reading, you can do audiobooks. I know on some tablets, you can do those magnifying words. So you can kind of put a lens over it on the app and it'll like magnify the words for you. And then again, we kind of talked about those earlier prism lenses, which could be done with a neuro-ophthalmologist, which survivors of stroke could go visit and discuss with and see if that's something that's be appropriate for them. And so that's it for visual field cuts and loss following a stroke. And I look forward to talking with you guys next time for our next topic. See you guys then.